Do Africans really need sunscreen? Let's debunk this myth. Every day in my clinical practice, I meet patients who you prescribe for sunscreen, are given SPF, and they're like, Doctor, do we really need this, or you just want me to scrape money? We have a zungu. Well, that's pause. Let me tell you why. God in his mightiness, he designed us with so many protective mechanisms, and one of them is melanin production. We the blacks are kind of blessed in a way that we have more protective, we have a more SPF compared to our fellows, the fair skin. Or we have a natural SPF of about 8 to 13. Some books say even 14. But either way, it's way below 30, which is a desired SPF. This is it. Yes, however much you may be at a more advantage compared to the fair-skinned ones, we still need it. So the sun gives invisible rays called the UV rays. They're invisible to the eyes, but the skin really feels them. Think of them like arrows. Arrows can hit deep, or they could be just on the surface. That's what the UVR does. The UVA and UVB. The UVA stops on the skin. It goes deep to the dermis, like you've seen in some other video. Please watch if you've not watched it. It hits deep, destroying the collagen and the elastin. And this leads to photoaging, hyperpigmentation, but more so photoaging. Then the UVB hits on top. That is the epidermis, and this causes sunburns. But a cumulative effect of both leads to skin cancer, which happens in blacks. So I come back to the question, do Africans really need sunscreen? Yes, we do, because of what I've just mentioned. And the sunscreen should be with the SPF. SPF is sun protection factor, and it measures how effective the UVB is. So the sunscreen you're using should have an SPF of 30 or more. And then it should also be broad spectrum, covering both the UVB and UVA. Then the UVA, how do you know it has UVA? Because I've said SPF is for UVB. So UVA, usually you see on that SPF, there was a circle covering, just like you see in this picture, or sometimes they are just stars. That's when you know that this sunscreen is a broad spectrum. But you also have other protective measures like long-sleeved shirts, wide-brimmed hat, like the one Mzee puts on. Our dear president, I think he knows enough about dermatology because he's always putting it on. Anyways, yes, even though we're Africans, we still need the sunscreen. I hope I've just destroyed that nail. Keep following for more comments. Let me know what your thoughts are. Remember, a healthy skin starts with the right information. Bye.